Hello, I am Nancy Kruger, Chief Nursing Officer of UMass Memorial Medical Center. Along with my CNO colleagues at our other hospitals, I am happy to speak with you today as you begin your training on Soarian, the new acute care electronic medical record that will replace Meditech in November. We are scheduled to go live with Soarian at the Medical Center, Clinton, and Marlborough hospitals on November 1st, 2011. One of the major components of Soarian is clinical documentation for nursing. This new electronic documentation will be a change for some nurses because the charting methodology in the electronic system differs from how nurses currently chart using paper documentation.
I'm Lisa Colombo, Chief Nursing Officer at Health Alliance Hospital in Leominster and Fitchburg. The Nursing Informatics Council is a group of unit-based staff nurses representing all of the hospitals in our healthcare system and has developed the Soarian Electronic Nursing Documentation Program using the Charting by Relevance philosophy. This means that you'll use Soarian's electronic documentation to record specific nurse-patient interactions for a particular time and date by utilizing your clinical judgment and experience. Based on your assessment of the patient for each of those interactions, you will chart on the portion of the electronic documentation that is applicable to that interaction, and you will leave blank any fields or sections of the documents that do not pertain to that specific encounter. For example, the neuromusculoskeletal document that is part of the Soarian assessments contains a section where you can chart a Glasgow Coma Scale. You can determine, based on your assessment of the patient, when it's appropriate to chart on that section and when you can leave it blank.
I'm Mary Brown, Chief Nursing Officer of Marlborough Hospital. The decision to use the Charting by Relevance philosophy was made after lengthy discussions both within the Nursing Informatics Council and by the System CNO group. I, along with the other System Chief Nursing Officers, provided the direction for the Nursing Informatics Council and our partners in the IS department to build the new electronic documentation using the Charting by Relevance philosophy. In order to be prepared for the November 1st Soarian Go Live, each nurse will attend a total of 12 hours of classroom training. The instructors are experienced IS trainers and nurse educators. The trainers will often be accompanied by a super user for each class. The super users are members of the Nursing Informatics Council or other staff nurses with additional training on the Soarian EMR. The training of clinical documentation portion of the release will be 8 hours long. The training for the orders and results portion of the release will be 4 hours long. Currently, some orders and results are entered into Meditech. With the implementation of Soarian on Tuesday, November 1st, 2011, Meditech will be discontinued. The training instructions will teach the staff nurses how to view these results and place orders in Soarian. Examples of ordering and viewing now available in Meditech include laboratory and radiology results.
I am Ward Mulford, Chief Nursing Officer of Wing Memorial Hospital. Training for use of the Soarian system will be completed by November 1st, 2011. The Go Live for Soarian will occur on November 1st, and Meditech will be discontinued. However, the rollout for the nursing documentation functionality will proceed by a carefully orchestrated, phased-in approach. The phased approach will begin on November 1st. There will be many support people available for Go Live help, including members of the Nursing Informatics Council, the nurse educators, nurses trained as Soarian super users, the entire IS Soarian clinicals team, other IS staff, Siemens personnel, consultants, and possibly contract nurses skilled with Soarian. Also, the IS training department has worked with Siemens to create a number of Soarian tip sheets to assist nurses as they begin to use Soarian. And finally, e-learning tools will be available at all times.
Hopefully we've helped answer some of your questions and alleviate some concerns regarding the charting philosophy, training expectations, and Go Live experience so you can move forward with your training positively and confidently. We understand that this period can be very stressful. We, along with our colleagues in IS and the medical staff, will work diligently to minimize the strain. Thank you.